Today, we're diving into a curious physical sign that's had doctors scratching their heads for decades. We're talking about a simple crease on your earlobe that might just be telling a much deeper story about what's going on inside your body.
So, let's just get right to it with a question that, I'm not going to lie, might have you running to the nearest mirror. It sounds a little out there, right? But believe it or not, a surprising amount of research suggests the answer could be, well, quite a lot.
So, in this first part, we're going to break down exactly what this sign is, what it's called, and where this whole medical detective story even got its start.
And here it is. This little line is known as Frank's sign. You can see from the definition, it's a specific diagonal crease. It runs from the tragus, that's the little flap of cartilage right at the front of your ear, all the way down to the bottom edge of your earlobe, usually at about a 45-degree angle.
Now, this isn't some newfangled theory from the internet. Nope. This observation goes all the way back to 1973. An American doctor, Saunders T. Frank, was the first to publish his findings. And that kicked off a scientific debate that has been going on for over 50 years now.
So what is the connection, really? I mean, why on earth would a little wrinkle on your ear have anything to do with your arteries? Let's take a look at what the researchers have consistently found.
Across dozens and dozens of studies, a clear pattern started to pop up. Scientists kept seeing this association between Frank's sign and several types of vascular disease. We're talking conditions that affect your blood vessels, from the arteries in your heart to the ones in your brain and even your legs.
So, you're probably asking, but why? Well, scientists don't think it's just a random coincidence. The earlobe is actually packed with tiny blood vessels. The theory is that it all comes down to the breakdown of elastic fibers. And guess what? That exact same process is a key part of atherosclerosis, the hardening of arteries all over the body.
Okay, so that's the theory. It makes a certain kind of sense, but what does the data really say? Let's get into the hard numbers from some of these studies, because this is where it gets really interesting.
Let's start with a number that just makes you stop and think. One study looked at 241 patients who were in the hospital because they just had a major stroke. Get this. A staggering 78.8% of them had Frank's sign. That is almost 4 out of every 5 stroke patients in that group. Wow.
And the connection holds up even in autopsy studies, which is pretty powerful evidence. Researchers looked at deceased individuals and found that Frank's sign was way more common in people who had died from cardiovascular causes, compared to those who died from something else entirely.
In that same study, they dug even deeper. Even after they accounted for things like age and sex, they found that having Frank's sign was linked to 7.77 times higher odds of having a critical blockage in your heart's arteries. That is not a small number. That's a huge statistical flag.
Okay, so those numbers seem incredibly compelling, right? But like any good science, the story isn't quite that simple. There's more to it. So it's time for a little bit of a reality check on what this all actually means. Before anybody jumps to conclusions, we have to ask the most important question of all. Is Frank's sign a true, independent predictor of disease? Or is it just a fellow traveler? Something that happens to show up alongside another very common factor? And right here, this is the heart of the whole scientific debate. On one side, you have this really strong, statistically significant link to vascular disease. But on the other side, its actual accuracy as a diagnostic tool, it's described as modest. And there's this big confounding variable we absolutely have to talk about.
Yeah, this quote from a 2023 study really hits the nail on the head. Despite the association, researchers are very clear. This diagonal earlobe crease, or DELC, is not reliable enough to be used all by itself to diagnose someone with heart disease.
And here it is, the big reason why. Age. Think about it. As we get older, our skin just naturally loses elasticity, which means wrinkles and creases are more likely to form. At the very same time, age is one of the absolute biggest risk factors for heart disease, so it's really tough to separate the two. Is one causing the other, or is age just driving both of them?
Okay, so we've got this fascinating sign, there's a real statistical link, but it's not a diagnostic crystal ball. So where does that leave us? Let's boil all this down into a clear, practical, and most importantly, non-alarmist takeaway.
First things first, the point of all this is not to make you worry. Seeing a crease in your ear is not, I repeat, not a reason to panic. The real value here is just being aware and using this little piece of information as a tool to start a bigger, more important conversation.
So here's a totally sensible 3-step way to think about it.
Number 1, see the sign as a potential clue, a little prompt for curiosity, but definitely not a diagnosis. 2, focus your energy on the real, established heavy hitters, the known risk factors. And 3, if you're concerned, just use this as a great reason to have a proactive chat with your doctor about your heart health in general.
And this really is the bottom line, summed up perfectly in a 2020 review of all the research. The recommendation isn't to diagnose based on the sign. It's to use it as a trigger to go check for the known risk factors, and if you need to, get started on preventative care. It's simply a call to be proactive.
All of this leaves us with one final, pretty thought-provoking question, doesn't it? While Frank's sign might not be a perfect predictor, this whole half-century of research is a great reminder that maybe, just maybe, we should pay a little more attention to the subtle and sometimes pretty surprising messages our bodies might be trying to send us.